within the UK Destiny study, we looked at reducing the dose of tyrosine kinase inhibitors with a view to then stopping therapy in patients who retain their optimal response. So our approach was slightly different to some of the other European studies such as STIM and Euroski, which directly went on to stop patients who had a deep molecular response. So our hypothesis was that we'd be able to reduce the dose in a wider range of patients, and we would also be able to reduce the side effects in those patients because they were on a lower dose of their tyrosine kinase inhibitors. We recruited 174 patients to the study. We recruited the patients in two groups. We had a group that were in major molecular response, which was 49 patients, and we had a group that had MR4, so had a much deeper molecular response, and that was 125 patients. Within the group that had MR3 or major molecular response, 9 out of 49 patients had recurrence of BCR-ABL above a level of 0.1%, which was 18.4% of the patients, whereas in the group that had the deeper molecular response of MR4, only 3 out of 125 patients, which was 2.4%, had an increase in the BCR-ABL gene above 0.1%. So we were able to show that in both groups we were able to safely reduce the dose of treatment in the majority of patients. For those patients where the BCR-ABL level did rise above 0.1%, all patients were able to safely be restarted on full dose treatment and were back within an optimal response within 4 months. So we can say that stopping the treatment is safe. We didn't have any patients that progressed to a more aggressive form of leukemia. All the patients retained sensitivity to their original tyrosine kinase inhibitor. We didn't see any resistance. And importantly, when we reduced the dose of treatment, we saw a significant improvement in side effects in those patients that reported side effects at the start of the trial. We also saw that the side effects improved within the first 3 months of reducing the dose of therapy, but thereafter there weren't any other improvements in side effects. So we can also see that very rapidly on reducing the dose of the tyrosine kinase inhibitors, patients were able to benefit in terms of side effects and improved quality of life. So we did a brief cost-saving analysis. So for the 174 patients within the study, the total cost of tyrosine kinase inhibitors for the 12 months would have been £4.1 million. By reducing the dose to 50% and taking into account the increased monitoring costs, we were able to save £1.9 million. That's in the current market where the tyrosine kinase inhibitors are branded Gleevec and branded Sprycel and Tasigna. That there is going to be a significant change in the market in the next few months as generic imatinib comes on board, so these cost savings will not be so great in the future, but they will be retained for the second generation drugs which are not going to become generic for a number of years, so there will still be substantial cost savings in the future.